Adler on the line with us as promised. Good morning, Congressman. Welcome to the Molotsky Money Hour.
Gentlemen, it's great to be back with you. How are you all doing?
Very good. You're supposed to have a sunny day when you call in, Congressman, but today it's a little cloudy here. So.
It's a little dreary outside, but it's good to talk to you guys. You're bringing a little sunshine to your listening audience.
You're very well put. Okay. Thank you very much.
Congressman, I'm sure Stan reported to your office, but last week we started the show and asked the question just for people to call in and give us their opinion of the health care bill, and we didn't have one positive phone call. Everyone was basically against
Overwhelming.
it. Overwhelming.
It wasn't even close, and we even had calls after the show during the week, and people said, they listened and they didn't get a chance to call, and I'm sure there were people that conceptually, as I do, and most people, and I'm sure you do too, Congressman, you want something to be done, but you want it to be done in a way that makes a certain amount of sense. So I guess my first question to you would be, your vote on the health care bill was, and why did you vote that way?
I voted against the health care bill. I voted against it back in November when it came to the House of Representatives. I voted against the Senate version when it came to the House with all its sort of gimmicks and payoffs to Louisiana and Nebraska and other states. I voted against the final version of it as well. I think we need health care reform. I think it's foolish not to recognize that fact, and clearly we should go after waste or fraud, abuse in the Medicare system, the Medicaid system, but I think we really missed a chance to bring some common sense solutions to bring down the cost of health insurance and health care without sort of putting big taxes on and maybe getting in the way of the doctor-patient relationship. I think there was a better way to solve a problem. It's a complex problem, but I think we missed a chance to do it in a way that would sort of bring our country together and give us hope that we've done the right thing.
Well, that's my feeling exactly. You look at this and you look at some of the things that are now coming out, the concept is terrific, but when you get down to the nitty-gritty and you get down to the cost and you get down to what it all comes to, it really doesn't make a lot of sense. So I guess the other question a lot of our listeners have is, as a Democrat voting against this, because this is what you have been championing for from the beginning, what kind of pressure did you receive prior to your final vote? We allowed to ask that?
Of course you're allowed to ask it. I've got to tell you, by and large, I felt no political pressure to vote as a Democrat. I certainly spoke directly with the President of the United States a couple times on the issue, once back in October, once just a couple weeks ago before the vote. And frankly, he couldn't have been more of a statesman in advocating his view on the bill. It's now a law. We had a very respectful conversation, and I think if people had seen it, they would have thought he was arguing his points well. The point I kept arguing over and over, and I would still argue, is that we missed a chance to slow the increase in premiums for small businesses and for families that purchase their own insurance. And at the end of the day, if we don't make things more affordable for business, we're hurting our private sector economy. We're hurting job creation and job retention. We're missing a chance to make our economy stronger going forward. And I think that was just a huge, to my mind, fatal omission in the legislation, and it's the principal reason I voted against the bill, was the absence of cost containment. But I didn't really feel pressure of people telling me I have to vote like a Democrat. And frankly, throughout the district, where I'd had many, many town hall meetings, I got the same sense you got from your listening audience, that by and large it was overwhelmingly an unpopular proposal. And I think the idea of legislation is try to respond to the people and try to meet the needs of the people. In terms of pressure, if anything, I felt pressure not to vote for the bill because more people in the district seemed to be against the bill. But I tried to do what I thought was right for our country and for the district, and I think we could have done a much better piece of legislation if it had had cost containment to help business, to help our economy going forward.
Well, the cost containment part is absolutely correct. You look at some of these things and you look at the projections, even you go back to, when Medicare became what it did and the projections in relation to that, and all of a sudden, in 5 to 10 years, the projections were way, 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 way short even then. So when you look at the numbers for this bill, it seems that the projections will even be substantially greater. And then when you take it to the next step and you look at what companies are already being forced to do, or looking at what they're going to be forced to do as far as making it available, mandatory. Well, some companies will basically back off and hire fewer people. And the fact that the fine, if you don't put people on based on the number of employees that you have, is less than what the actual cost of the coverage would be. So a lot of companies are going to say, hey, from a cost point of view, I'll take the fine and won't bother to pay.
Well,
so,
I think you're exactly right. I think that's a very foreseeable set of results you just laid out of companies not being able to afford to hire people, or dumbing down the quality of insurance, or as you just said, maybe stopping coverage for their employees completely and just paying the penalty and letting people buy sort of much cheaper coverage on their own in a way that isn't good for the families of the employees, isn't good for public health. I think there are a lot of ways we could have made this work, and I think they were eager to get something passed. I understand the sense of urgency people feel, but if it doesn't actually help our economy, it doesn't help businesses hire people and give them the sort of coverage that they deserve, we're really missing a chance to look at the big picture.
We're talking to Congressman John Adler from Ocean, Burlington County, and parts of Cherry Hill. He's with us this morning, spending a couple of minutes with us discussing the health care bill and other things. If you have questions for the congressman here in the Molotsky Money Hour, 732-364-5830, our number in Ocean and